So in this PowerPoint, we are going to talk somatic symptom and related disorder, means conversion disorder. The somatic symptom disorder, the form of mental illness where the patient experience the physical manifestation that are the result of psychological factor, and there are no underlying physical or pathological cause of the disease. So somatization is the expression of psychological trace and through the physical manifestation. So my psychological trace expressed through my physical manifestation. The physical manifestation of somatic symptom disorder cannot explain by underlying any pathology. And somatic symptom causes distress for the client, and manifestation can be very huge or vague, also exaggerated. So the patient who diagnosed by somatic symptom disorder, if you take the patient history, you can get they spend a significant amount of time under the stress or worried about their physical manifestation to the point where it is assumed a central role in the client life and relationship. So if you ask me what are the risk factors of somatic symptom, usually female gender, female is attacked more, or teenager, young adult, childhood trauma, mental illness like depression, anxiety, personality disorder, or recent stressful events. So if a patient has a depressive disorder or personality disorder or anxiety disorder, they have a chance to develop somatic symptom. The patient usually give a history of childhood trauma, abuse, or neglect. So what are the expected findings? Let me read it. The client focuses on physical sign and symptom and is unable to control the sign and symptom. So it is not voluntary. The physical sign symptom increase with psychological stress. When they undergo to the psychological stress, their symptom increase. Like autoimmune disease. When patient under stress, anxiety, their symptom increase. The anxiety is redirected into the somatic concern. The client may unconsciously use somatization for secondary gain, such as increase the attention and decrease the responsibilities. What next? So before to go conversion disorder, I could tell you what are the nursing intervention for somatic symptom, right? It is very important. So when you giving the care to the patient, accept the somatic symptom as being real to the client, because patient feel good. Also assist for suicide ideation or thoughts of self-harm, or identify the cultural impact on the client's views, health, and alternatives. Identify the secondary gain from somatic symptom and report the view physical manifestation to the provider, and limit the around the time allowed to discuss the somatic symptom. We encouraging independence of self-care, we encouraging the verbalize their feelings or educate the client or alternative coping mechanism, and also encouraging the daily physical exercise if possible. So obtain history, check for physical problem, assist the client to identify the problem and their needs, assist the client to related feelings or convey understanding. What next? So also explore the source of anxiety, encouraging the use of relaxation technique, use of pain assessment scale, report and assess, encouraging the diversional activities. So what are the alternative way to coping? Also positive feedbacks, right? So nursing can continue about the somatic symptom, assist the client to recognize his or her own feelings, and also give them anti-anxiety medication. Anti-anxiety or antidepressant is very effective for your patient. So when you give the anti-anxiety or antidepressant or anti-anxiolytics, we educate our patient. So encouraging the client participate in individuals and group therapy, it is very effective. And also we educate the client on prescribed medication or assist a case manager to develop a follow-up appointment schedule with provider every 4 to 6 weeks. So here I'm saying the acknowledge symptoms is bring the real to the patient is very important. Or I said the admin this medication is prescribed, patient will be feel good. Now go conversion syndrome. So conversion syndrome here, this is the functional neurological symptom disorder, right? Functional neurological. So the conversion syndrome, also known as functional neurological disorder. So conversion disorder result when a client exhibit the neurological manifestation in absence of a neurological diagnosis. So you understand what are the difference between somatic and conversion? Somatic, the sign symptom only neurological, and there are no underlying cause or patient is not diagnosed with any neurological problem. So the client who have conversion disorder transmit the emotional or psychological stressor into physical manifestation. So neurological manifestation can cause extremely anxiety or distress in some client who other can exhibit the lack of emotional concern. And neurological manifestation cause a significant impairment in multiple aspects of the client life. The client who have the conversion disorder have deficit in voluntary motor and sensory function. What the book said, a physical symptom or a deficit suggesting loss or altered body function related to psychological conflict or a neurological disorder. Conversion disorder is an expression of a psychological conflict or needs. The most common conversion symptoms are blindness, deafness, paralysis, and inability to talk. So all are neurological problem. Conversion disorder has no organic cause. So patient absence of neurological diagnosis, symptoms, conscious control of the client are directly related to the conflict. Development of physical symptoms reduce the anxiety. What next? They said conversion disorder involves sensory or motor symptom not related to known physiological symptom in the body. Also, conversion symptom appears suddenly. Conversion symptoms are related to marked stress. So, what next? They said the different type of data collection. Before to go different type of data collection, I want to tell you who are under threat to develop the conversion syndrome. Usually first degree relatives who have conversion disorder or childhood physical or sexual abuse or comorbid psychiatric disorder. What does it mean, comorbidity? If any patient has more than two psychiatric problems, they have chance to develop conversion disorder. If any patient has a depression and anxiety together, or post-traumatic stress disorder, personality disorder together, they chance to develop. So comorbid medical or neurological condition, or if the patient has recent stressful events, and also as like the somatic disorder, female also more than the man. Hmm? So first of all, they said the la belly indifference. This is the sign, right? And also the physical limitation and disabilities or feeling of guilty, anxiety, or frustrated, and also unexpressed anger or conflict or secondary gain. Okay. So we can diagnose this disease like CT or MRI. So laboratory and diagnostic tests such as CAT scan or MRI can be performed to rule out underlying pathology, if any, but usually none we can get. So what are the nursing intervention if the patient has conversion disorder? We always build a good relationship trustable relationship with the client. So rapport and trust with the client, ensure the safety, and encouraging verbalized of feelings, educate the client on alternative coping mechanism, educate the client stress management, and also underlying the incidence of remission and recurrence of remission. Then we have to go the solve it out.